Cavalier King Charles Spaniels. The Cavalier Spaniels are descended from the same toy spaniels depicted in many 16th, 17th, and 18th century paintings by famous artists such as Van Dyck and Gainsborough. These little spaniels were great favorites of royal and noble families in England. Mary, Queen of Scots, had a toy spaniel that accompanied her everywhere. After her beheading, her grandson, King Charles I, gave his name to the breed. Her great-grandson, King Charles II, who reigned from 1660 to 1685, never went anywhere without at least 2 or 3 of these little spaniels. He even decreed that the dog would be allowed in any public place, including the House of Parliament, and it is claimed that this decree is still in effect today. The Cavalier King Charles Spaniels changed dramatically in the late 17th century. When King William III and Queen Mary I took over the United Kingdom, the breed almost became extinct due to the Queen Mary's preference for the pug. To save the King Charles Spaniel from the extinction, it was crossbred with the Queen's favorite pug breed, resulting in a flatter nose, a rounded head, and protruding eyes. Here's a picture of the old breed in the painting, the pug, and then the new profile of the modern-day King Charles Spaniels. The modern-day King Charles Spaniels are small but sturdy dogs standing 12 to 13 inches high at the withers. Their weight ranges for male is 13 to 18 pounds, for females is 10 to 18. The males tend to be heavier, taller, and stronger than the female dogs. Usually the size difference will only be a few inches in height, but it may be more significant in weight. The average lifespan for a Cavalier King Charles Spaniel for a healthy one will be 9 to 14 years. Based on American Kennel Club's breed standards, their head is proportionate to the size of the dog, appearing neither too large nor too small for the body. The eyes are large, round, but not prominent, and set well apart. The ears set high but not close on top of the head. The body, the top line level both when moving and standing. The chest is moderately deep, extending to elbows. Tail carried high happily, but never too much above the level of the back. Their shoulders will be laid back, forelegs straight and well under the dog, with elbows close to the sides. The hindquarters should come down from a good broad pelvis, stifles well turned out, and hocks well let down. The hind legs, when viewed from the rear, should parallel each other from hock to heel. Cavaliers have medium-length coats that are silky to the touch and may be slightly wavy. Adults have feathering on their ears, chest, legs, feet, and tail. Their coat comes in 4 colors, the most common being Blenheim. It is a rich chestnut on a white background. Some Blenheim have a thumb-shaped chestnut dot on top of their forehead, called lozenge. The tricolor is black markings on a white coat with tan markings over the eyes, on the cheeks, and on the underside of the tail. Ruby is a solid, rich reddish-brown with no white spots or markings. Some common unusual findings is thrombocytopenia and macrothrombocytopenia. Despite the low platelet counts, the typical Cavalier blood platelet functions normally, and the dog does not appear to experience any associated health problems. Some recommended health tests from the National Breed Club include hip evaluation, patella evaluation, cardiac exam, and ophthalmic evaluation. Some breed dispositions include mitral valve disease, syringomyelia, hip dysplasia, patellar luxation, cataracts, and entropion. Mitral valve disease is a degeneration of the heart's mitral valves. As the mitral valve degenerate, the valve no longer fully closes after each pumping action, allowing some of the blood to flow backwards through the ventricles back into the atrium. MVD usually results in heart failure in the Cavalier King Charles Spaniel. In fact, NVD is the leading cause of death of Cavalier King Charles Spaniels throughout the world. It has been found to be 20 times more prevalent in this breed than any other dog breeds. It is a polygenic disease which statistically have shown may afflict over half of all the Cavaliers by age 5 and nearly all by age 10. All Cavaliers should be screened for the sound of turbulent blood flow once a year, beginning at 1 year. If a heart murmur is detected, it should be confirmed in 3 to 6 months. If it is still detected, the dog is considered probable for NBD. Care should be taken when anesthetizing Cavaliers that are older or have severe NBD. Dogs with left atrial enlargement caused by NBD cannot excrete sodium load efficiently, and therefore during the anesthetic procedure, administration of a saline or lactated ringer solution is not recommended. Instead, an IV sugar solution of 5% dextrose in water is advised. Specialists recommend that an anticholinergic should be administered as needed during the procedure. The dog's heart rate and rhythm should be monitored during the procedure as well. Syringomyelia. The Cavalier King Charles Spaniels are prone to caudal fossa overcrowding, a deformity affecting an area of the skull that causes a disruption in the flow of cerebrospinal fluid. This disruption causes a neurological condition. This disease is also called neck scratcher's disease because of one of the common signs associated is scratching in the air near the neck. The only accurate way to confirm diagnosis of the disease is through an MRI scan, which allows a veterinarian neurologist to study the spine for the presence of any abnormalities which might obstruct the flow of cerebrospinal fluid. Syringomyelia is a late onset condition, and the minimum age for screening is 12 months. For these reasons, it is recommended that an MRI status starts at 2 to 3 years and again at 6 years of age. Hip dysplasia is one of the most common skeletal diseases seen in dogs. It is a hereditary condition in which the ball and socket joint is malformed, resulting in a joint that rubs and grinds instead of sliding smoothly, leading to lameness and arthritis. Early onset usually develops after 4 months of age. X-rays are crucial for visualizing the signs of hip dysplasia. X-rays will be taken for comparison with previous X-rays during the follow-up appointments to monitor for any changes. Patellar luxation. A genetic deformity of the femur causes the patella, or kneecap, to shift out of place and become misaligned. Affected dogs may appear to have occasional lameness, or the dog may skip about. This congenital condition is most often observed in puppies 4 to 6 months of age. If you believe this condition may be present, your vet can conduct a physical exam and take some X-rays. Cataracts is an opacity in the lens of the eye, causing blurry vision. The Cavalier King Charles Spaniel is prone to developing either of 2 types of hereditary cataracts, the most common form being the early onset juvenile cataracts. This congenital form of cataracts is bilateral but not necessarily symmetrical. The 2 eyes can be affected to different degrees, and it is often associated with microphthalmos, an abnormal smallness of the eyeball. The more severe the microphthalmos, the more extensive the cataract. Entropion. Cavalier King Charles Spaniels have a relatively high incidence of entropion, which is an inward rolling of the eyelid's edge. It's most often affecting the lower eyelids of one or both eyes. The hair on the affected lid continuously rubs against the cornea and can cause significant discomfort or trauma to the cornea. It usually develops within a few months after birth. All Cavalier King Charles Spaniels should be examined at least annually by a board-certified ophthalmologist. As veterinarian technicians, knowing about the general health concerns specific to Cavalier King Charles Spaniels is important. Along with the veterinarian, our job is to tailor a preventative health plan to watch for and expectantly prevent particular health conditions. During the regular yearly vaccination visit, we have our opportunity to give the necessary checkups and talk with the client about signs associated with specific breed genetic predispositions. By actively watching for any abnormal symptoms as the patient age, we can promote the Cavalier King Charles Spaniel's longer, healthier, and happier lives. Thanks for watching. The end.